So let me introduce my guests. Vijay Kedar, the CEO of Tomorrow Health, and Nimi Katragadda, who is a partner at BoxGroup. So thank you both for joining today. You're a founder-funder team because Nimi invested in Vijay. And so we're going to get into all that. But first, I'd love for you to just give a brief intro. Nimi, why don't you start?
Hey, everyone. Really nice to meet you all. Thank you for joining. My name is Nimi, as Bunny said. I am a partner at an early stage fund here in New York called BoxGroup. So we've been around for about 12 years as a fund. We are very early stage focused. So we love investing in companies as early as possible. Usually that's part of a friends and family round or a first institutional seed round. And we're very much generalist investors. So for us, it's really about people. And we feel like we're, making bets on people and ideas across many different spaces, certainly including healthcare, but also fintech, consumer, synthetic biology, enterprise SaaS. So it, really is far-reaching, crypto as well. And, for us, we just love identifying and finding new themes, and healthcare has been one that we've been investing into really for the past 10 years. We are a team of 9 people now, and we invest sort of all over the US, but certainly have a really high concentration here in New York City, but then certainly in the Bay Area as well. And then, is that good? That's enough?
Yes, that's great.
Perfect.
And Vijay?
Fantastic. Well, Bunny, thank you for having us on here. It's really a pleasure. My name is Vijay Kedar, co-founder and CEO at Tomorrow Health. Our vision at Tomorrow is to restore the home as a patient's primary point of care, and we do so as a marketplace to coordinate the breadth of medical equipment, supplies, and services that patients need to heal at home. A bit about my background. In many ways, I grew up in the healthcare world, was born into a big family of physicians. I like to say I was pre-med coming out of the womb, but initially started my career investing in healthcare. I was at Goldman Sachs and their private equity arm, investing in healthcare tech and services companies for a number of years. In 2014, had the opportunity to join what was in many ways one of New York's earliest health tech companies, Oscar Health. Joined them when there were a few dozen folks in 2014 and scaled with the business as we grew to over 1,500 team members and driving $1 billion in revenue. Had the opportunity to wear a bunch of different hats there, led the company's strategy and finance division, led their Texas division as general manager, and led tenets of the company's clinical strategy at the national level. And then started Tomorrow Health a number of years ago, largely driven by a personal experience I had managing my mother's home-based care. So really excited to be here with all of you.
Stop there. Yeah, stop there. You can't talk to a founder, an entrepreneur, without getting the founder story, right? And I've read the story, which is, so I think that would be great for you to open and share the founder story.
Yeah, no, happy to. The inspiration for a business was a very personal experience that my family had in managing my mother's home-based care. She was a stage 3 cancer patient, fortunately is doing well now and in remission, but had a tough journey through it as too many do. She spent about 4 months inpatient in the ICU, about 3 months on a ventilator, battling a lung disease. And coming out of that, needed a year of very intensive home-based healthcare. Everything from 14 liters of oxygen to ostomy and wound care supplies, mobility and respiratory equipment, physical and respiratory therapy. And I'll say, despite being in the healthcare world, despite coming from a family of physicians, just could not have imagined how challenging that process was to manage. We were guided by our insurance company to go to nearly a dozen different DME suppliers and home-based care vendors to get the breadth of what she needed. I was driving out to smaller mom and pop shops with medical equipment scattered everywhere. I'd have a prescription for a CPAP machine that just said CPAP on it. I soon learned there's 24 types of CPAP machines. What someone with chronic obstructive pulmonary disease needs is very different than someone with sleep apnea. Navigating her insurance benefits was another nightmare. Faxing forms back and forth between the insurance company, her physician, the discharge manager. And all in, it took us about 6 weeks to get everything she needed. And unfortunately, due to the delays in mismanagement, we ended up having to readmit her back to the hospital twice in that first month. So deeply, deeply disruptive to her care and demoralizing after working so hard to leave the hospital. From there, I went back to Oscar and saw a lot of the same challenges, but from the health plan's vantage point. I was building out our networks in Texas and found that in every market, we had to contract with hundreds of local medical equipment supplies and home health agency companies driving care management. I'd find myself borrowing the phone from one of our nurse case managers on a Friday night and really negotiating with some of these local home-based care vendors to get our members the products and supplies that they needed. And so it just became clear to us that while so many across the healthcare ecosystem really believed in that systemic shift of care to the home, the infrastructure to enable that reliably and at scale was simply lacking. And that's what we've been working to build here at Tomorrow Health.
So how did you and Nimi meet? And Nimi, what was interesting about this particular company?
Happy to start. You know,
Oh wait, Nimi's on mute.
You go for it. You start off.
Okay, sure. Yeah, no, I'll start and then you can get the full scoop from Nimi. But you know, I've been fortunate to know Nimi before either of us were founders or funders. We were friends in college, and you know, I'll say when I was really thinking about starting the company, she was one of my first calls. You know, she's somebody who I've deeply respected for years and has always been such a phenomenal thought partner, from the decision to go to Oscar to the roles that I had there to really start contemplating doing something to solve some of the problems that I'd become most passionate about. And so that was the genesis from our end. And I'll just say, you know, very, very thankful to Nimi and the BoxGroup team, because, you know, even before we officially founded the company, we spent, you know, probably was a summer working out of the BoxGroup offices and using their whiteboards. And it was really just such a pivotal time, as it is for so many companies that are really developing those early ideas, and to have that support and that guidance at that stage was so helpful.
Yeah, I mean, just echoing that, I think Vijay and I were lucky to be, you know, friends before this, which I think is often the basis of a lot of these relationships. I think one of the things that I've been probably, you know, has been most interesting for me in having a career in venture is that it's very personal. Like, I think that the lines between professional and personal really blur. Like, ultimately, these are relationships. And so I think we've been really lucky to have a relationship before this. And, you know, I remember so vividly, you know, Vijay had texted me at some point. He was at Oscar. He had gotten into business school. He was thinking about going, but also was really excited about pursuing an idea. And at that point, you know, I immediately thought in my head, like, as soon as he, you know, formally decides he wants to work on this, we have to be part of it. And so we were very, you know, I think really lucky to be able to stay in touch. And as he said, you know, I think Vijay did an awesome job of sort of being in business school, but also working on this very much, you know, full force on the side. And it was great to be able to see that happen and be able to offer him, you know, space and just be a thought partner at that earliest stage when, you know, it wasn't a formal company yet.
Okay, so I didn't know this. All right, so I guess there's a lot of HBS on this call. We all went to HBS. And so when you were there, like, how did you manage to do the company and, you know, not hit the screen? Do they still say that?
Yeah, it's I'll say is Nimi had mentioned, you know, when I had gone into business school, it was really to use the time and the headspace to get the business off the ground. And you know, I found it was a great opportunity for that. Was able to engage with a range of folks that were phenomenal thought partners, whether it was from other collaborators to professors. And you know, I'd say especially in the second half of my time there, really just had a tremendous amount of flexibility to really focus on the company. You know, that summer I spent in New York, I think my second year there. I hope there's none of my former professors are on the line here, but you know, I think I was in class probably 1 or 2 days a week, and the other 5, you know, in New York, building the team and working on really getting the business going. And I, you know, it was a really helpful kind of area to incubate, and then ultimately it was really kind of building that team and plugging back into the ecosystem in New York that had grown so much from a health tech standpoint since the early years that I had been at Oscar, that really helped us to accelerate and move things forward to the team of over 130 that we have today, and
Wow.
the impact we've been able to drive.
Okay, so let's fast forward. You start the company, and COVID hits, right? So what has your life been like over the past 18 months or almost 2 years at this point? And what's it meant for Tomorrow Health?
Yeah, absolutely. I'll just start with just one or two lines on what it is that we do for the group here.
Oh, yeah, of course.
How that contextualizes within, these last couple of years. So ultimately, as it referenced, we're a marketplace to coordinate medical equipment, supplies, and services for patients who need healthcare at home. And so we work today with about 125 health plans regionally and nationally to coordinate and manage home-based healthcare for their members. And so these can be individuals that, like my mother, are recovering from an acute health episode and need weeks or months of home-based care. It can be folks managing ongoing chronic conditions like diabetes, cancer, or cardiovascular disease. And we really sit as a technology layer on top of a wide breadth of partners, providers, and suppliers in the space to really coordinate the patient journey end to end, help patients to navigate identifying the right suppliers, the right clinical products, navigating insurance benefits, and ultimately remaining healthy and safe at home. And we've been very, very fortunate over the last couple of years to service tens of thousands of patients, delivering an over 95 NPS score across the breadth of patients we've served, something that we really hold close to heart. And so, to your question, Bunny, the pandemic, it was just incredibly eye-opening, right? We were building a business towards enabling patients to heal at home and to really bringing together the technology, the operations, and the logistics to leverage existing provider networks to enable patient care at home. And very, very quickly in March of last year, the world changed, right? All of a sudden, 300 million Americans were homebound, 7 out of 10 managing a chronic condition, but now without the traditional access that they had to retail healthcare, to providers' offices, to hospitals. Nobody wanted to step foot in a hospital, of course, for fear of contracting COVID. And so it just created this tremendous amount of need for home-based care. And I'll actually say our company hadn't formally launched then. We were planning to launch in August of later that year, but we sat around the table as a team, or really sat around the Zoom as a team. And what we just saw was, so much need for the product that we were building, and, saw no better way to fulfill our mission and our value proposition to patients than really accelerating that launch. And I'll say I give so much kudos to our early team that worked around the clock, days, nights, weekends, at what was a very chaotic time for everyone, to really get the pieces in place for us to be able to launch as we did in May. And then really just seeing tremendous demand, from patients, from providers, from health plans, from government agencies. We developed a partnership with the New York City Mayor's Office to be the city's preferred provider for equipment and supplies for the city's seniors who are in need. And really since that point, it's just been, a whirlwind of a couple of years as we've been able to build and scale new partnerships, certainly build and scale our growing team, which is a huge focus for us, and ultimately expand that impact on a wider breadth of patients that need healthcare at home.
So Nimi, how involved do you get in all of this? You were one of the earliest investors, right? And I know, you had another funding round this year, right? So there are more, but how involved do you get in this, in day-to-day stuff? Oh.
Sorry, great. Our model, we're probably a little bit unique relative to certain traditional venture funds in that oftentimes we're not, leading rounds, but we're participating and we're part of them. And I think a core part of how we think about the working relationship, with founders, and I think Vijay can attest to this, is we think about delivering value even outside of a boardroom. So even though we may not be a formal board member, being a sounding board, being a thought partner, as he said, during different inflection points of the business. And so I think that ends up actually taking like quite a different shape for every company. That might be regular check-ins with some folks to, catch up every month. For others, it's like you're just always texting or on the phone with each other. And so I think our style is a little bit more of we want to fit into the working style ultimately of the founder. And that's just the approach that we take. And, it's interesting, relationships evolve. We have been lucky to be part of many different sort of healthcare journeys, including Oscar and Flatiron Health and Roe. And it's just interesting to see how those relationships develop. With Roe, they started in our office, similarly, worked in our office for 6 months. So you see them every single day. And of course, as they grow and mature, they raise a ton of capital, they have a full board. And so it might be now the relationship is like when the founder really wants to vent about something, right? When something doesn't go wrong, like you're their friend, right? You are you're equal parts therapist and thought partner. And so I think, we have to be dynamic about how those relationships evolve while still sort of like serving a role. And I think in some ways being aware also of who the company and the founder also has around them supporting them.
Yeah, I definitely want to get to some of those companies in a bit. But Vijay, so you talked about all this expansive, explosive growth, right? Over the past 18 months. So what's that like? And what are some of the challenges that you're facing? And, like, what are your, people say, what keeps you up at night? But like, what's going on? And now that you're in this, explosion.
Yeah, no, absolutely. I'd say the first and principal focus for us is and is always around our team, and really bringing in folks from a diversity of backgrounds, as we've been fortunate to do, from leaders and individuals across healthcare, best-in-class engineers and product managers, from world-class technology companies, those in the operations and clinical spaces. And it's one of the unique things that we do as a healthcare technology company is bring really a diversity of backgrounds, perspectives, and professional backgrounds to the table to really unlock something differentiated in this ecosystem. And that's been, I'd say, the biggest part of that focus on growth for us is really building the team in the right way. And we've been really fortunate as our team has grown almost 10x of last year to bring on some exceptional folks, leaders who have built and scaled businesses to tens of billions of dollars at places like Uber and Amazon, individuals who have deep experience in the healthcare domain from places like Flatiron Health and Athena, and those who have created exceptional customer experiences. Kevin Rath, our head of customer experience, was employee 20 at Warby Parker and grew with them over a decade to lead a team of about 1,200, reporting to Warby's CEO, and now leads customer experience at Tomorrow Health. And so, as the business grows and unlocks into different stages, really bringing a team that reflects not only where we're at, but also where we're going. And for that, it's been, leaders who have built and seen scale, but also bring exceptional domain expertise to the company from other companies that have been world-class at that. So I'd say that's been the principal focus. And, right now, I mentioned our team has grown a ton. We probably have about 30 or 40 open roles across all those areas. So really looking to bring in people who are deeply passionate about, driving that level of patient impact. And that's, back to kind of what keeps me up at night, what I focus on. And it's really ultimately that, right? As we scale the business, as we unlock new partnerships that enable us to get to distribution, to, have the right and the opportunity to serve a wider base of patients and their families, really always focusing on the standard of patient care that we're delivering. Our first value as a company is to fight like hell for patients. And every week at our all hands, we play a patient story, generally a recording of one of our patients with our care advocates. And it just reminds us all across the organization why we do what we do. And I think for all of us, that's the thing that we're laser focused on. We get up in the morning, go to bed at night, is how do we really continue to not only maintain, but always be enhancing the quality of patient care that we can deliver and the status quo that we can set in the market.
I think, when I look at Tomorrow Health, you are really the nexus of consumerism and medical, you really mesh, right? And So that comes through. I mean, in healthcare for years, we've been talking about the consumerization and the consumer. Yeah. So can you give us an example, like of one of those patient stories that sort of exemplifies what you're doing differently than, because home care has been around. I mean, it's been chaotic, but it's been around. So what are you doing differently?
Absolutely. You mentioned the COVID pandemic, and as you can imagine, it spurred really just a tremendous amount of need, particularly in many areas of home-based care, but as it relates to medical equipment for respiratory equipment and supplies, things like oxygen, ventilators, CPAP machines, really life-saving equipment and supplies that for many patients was deeply challenging to get, right? So we had a patient who he was an elderly gentleman in his 80s. That was visiting his grandkids in New York and Brooklyn. Unfortunately, caught COVID. Ended up spending 2 weeks on a ventilator in a New York hospital, and because the hospitals were just at such peak capacity, they had to discharge him a lot faster than he otherwise would, and sending him home. The problem was they couldn't access the right equipment and supplies to enable him to remain at home in a healthy and safe way. And so his wife was calling around to a bunch of different locations, got connected through their insurer to Tomorrow Health. We were able to coordinate through technology-enabled operations, getting him the oxygen, the mobility equipment, and the respiratory supplies he needed in that next day. And our team of care advocates worked with him and his wife over the next 2 weeks, almost daily, to ensure that he was able to get back on his feet, complete his respiratory therapy, and ultimately, remain healthy and safe at home. And so it's really that combination of technology and personalized service, as you noted, that really drives what we do. But it's all about making that patient journey and experience much more simple, guided, and easy to navigate.
So you've mentioned, or you've talked a lot about partnerships, right? And something I hear from a lot of startups is just how difficult it is to get to payers, or, get to health systems or employers. So what do you think has been what advice do you have for those who are trying to get in front of those kind of partners?
Yeah, absolutely. I think the first is really, truly, treat them like customers. I think for, in the kind of lean startup ethos, right, it's all about talking to, listening to your customers, understanding where there's real customer pain. And I think it's no different when that customer is the enterprise, right? And, we learned from hundreds and hundreds of conversation with, health plan executives on the top level, all the way down to care managers on the ground level, right? Sitting with hundreds of hospital discharge managers as they were helping to click through their EMRs to discharge patients home, talking to, hundreds and, now tens of thousands of patients, medical equipment providers, physicians, right? And so really listening to your customers and understanding that customer pain. And for us with the insurance companies is really identifying, that desire to transition more healthcare to the home and looking for the resources, the technology, the infrastructure to enable that. So I think that's the first step. I think the second is, really thinking about your team a bit more expansively, right? And one of the ways that we've done that is by bringing, not only through our base of investors, and in addition to Nimi and the team BoxGroup, fortunate to be supported by firms like Andreessen Horowitz and Obvious Ventures, Rainfall Ventures, and others, but also a really exceptional group of industry advisors. And we've brought on a range of folks like Steve Nelson, the former CEO at United Healthcare, Alan Murray, the current CEO at Empire Blue Cross, the largest insurer in the state of New York, Roy Beveridge, the Chief Medical Officer of Humana, Eric Hargan, the recent Deputy Secretary of Health and Human Services, all of which who are speaking with me and our team on a weekly basis, really to kind of hone that strategy, drive new business development, and help us engage with some of the enterprise stakeholders that you've referenced.
So one more question, and then I'm going to get to you, Nimi. So I often get asked by people, well, so I want to be an advisor to a company like Tomorrow Health. You just named like some really big, some big names. What about people who, have a lot of experience in healthcare, are senior in their roles, whatever? Are there ways for them to, get in front of you or to collaborate with you in some way as an advisor?
Sure. Is that for me? Yeah.
Yeah.
Absolutely. We welcome that. We're always looking to have conversations with additional folks who are passionate about the space that bring a depth of experience. And again, whether that's in healthcare or also the other components of our business, whether it's deep in operations, whether it's on the technology side, whether it's on the clinical side. I'd say what we look for in advisors is certainly folks who bring a differentiated experience and networks, but also folks who are really excited about the opportunity to partner with a growth stage company and really understand what that means, right? For a lot of companies, advisors are just names on the page for credibility. For us, it's very different. We really bring them into our process and are looking for folks who are excited to get engaged and get on the phone late on a Tuesday night to strategize about an idea or come with us to a dinner with an enterprise stakeholder. And we find that for folks in that camp that really believe in driving change in the healthcare ecosystem, it can be an incredible way for them to drive that, which is a bit differentiated from the way in which they work today.
So Nimi, as an investor, you started off, or you are a generalist, right? You're not, in healthcare, we've got all these healthcare firms that are deep into healthcare. BoxGroup is a generalist, has invested in some of iconic companies across the board. What drew you to healthcare? Was that a passion before, or was that more recent?
I think similar to Vijay, I feel like my immediate family were not doctors, but a lot of my extended family. And I think I always grew up with a ton of interest in the space. As I was sort of first becoming an investor, and I think really thinking about spaces where I felt like I could have an impact and where, there would be huge businesses created over time and a lot of value creation. It's, I think, really hard to ignore healthcare. You look at GDP spend, and obviously education and healthcare are two of the largest ones. And in particular, the ones where, you also have just not a ton of innovation as well. And so for me, that was just foundational. For us as a firm, it's interesting. When we first started, I would say we very much viewed healthcare as something that was very specific. And so, it felt like you had to be a healthcare focused fund to invest in healthcare. And I think over time, we just realized that wasn't the case. We were initially brought into healthcare through relationships. So PillPack and Flatiron Health were our very first two investments, and those really just happened to be founders we were close to who happened to be working in healthcare, and then there was sort of a virtuous cycle. But I do think that as I joined, and some of us on the team just started to spend more deliberate time, we realized that a lot of the problems that healthcare companies faced, whether it was, as you're saying, getting in front of payers or hiring a team or building a brand and awareness, those are problems that or just, generally things that all startups have to face. And so it felt like there were some things that we could, offer support on. And then I think over time, we also just developed a lot of the healthcare jargon and nuance and the sort of vertical knowledge there. But yeah, I think it takes time. And I think it's been a deliberate focus area over the past really 6 years, which has now led to, having a real thematic focus on it. I think the other thing, and I would just mention briefly, and I think it's obvious, and I'm sure obvious to many of the people here, but healthcare companies are hugely mission driven. And as we look at startups, the number one thing is hiring an exceptional team. And we've definitely found over the past several years that it's amazing to see companies be able to recruit exceptional people because they're drawn to the mission. And I think that's a really important advantage that early stage healthcare companies, can and should capitalize on.
Okay, so now the elephant in the room is the amount of money that has gone into startups in healthcare certainly over the past year, if not 18 months. In New York alone, we're almost at 9 billion for the year, right? Which is insane. So how do you think about that? And like, what's going on?
Yeah. I think there's two parts of the answer to this question. Like, one is the healthcare specific part, but I think there's this general, fundraising market dynamics at play.
Mhm.
On the healthcare side, I think that there's a few factors. One, I think people are starting to realize like digital transformation is possible, sort of something that you said, like consumerization of healthcare is actually happening now, right? There's more adoption, like payers are embracing some of these things that need to change. And I think you're seeing that just more earnestly happen. There's still, I think, a lot of things take time and move slowly, but I think you're starting to see that shift. So I think that promotes funding in the space. I think like you're starting to see individuals even act more like decision makers for their own health, right? And I think like that's really important. I think healthcare suffers from like a real moral hazard problem by not being like the ultimate payer. And then I think the other dynamic with certain healthcare businesses, like there is a real capital intensity, right? I think especially for companies that are, whether they're insurance, full stack insurance plays like Oscar, or if they are, care delivery models, like there is a real capital intensity to it. And so I think that's part of why you're seeing a lot of dollars flow into the space. But I think stepping back, almost a larger dynamic at play here is, companies are staying private longer, and there's just so much ability to create value as a private company. And so you're seeing a lot of funds just continue to be able to deploy capital. I think one of the things that we've noticed probably most strongly over the past 5 years and just the startup world in general is like companies are being king made early, if that makes sense. So there might be a few companies in a space and, you're just seeing huge funding rounds go to them. And as a result, they're able to build teams, create a brand, like really deploy that capital. And so I think that's happening in healthcare, but also in actually like every single other vertical as rounds get pulled forward, and they're just much larger than we ever sort of conceptualized before.
So I want to go to some Q&A from the audience. Anne-Marie, can we unmute Anne-Marie? Let's see.
Yes.
Oh, great. Hi.
Thank you so much, Bunny. I had a question for Vijay, because it seems like your process and culture is so important to the success of your company. So is part of your growth plan to acquire existing home care agencies, or is it purely organic?
It's a great question, Anne-Marie. Thanks for asking. It's purely organic. So, when I think about ways to innovate in healthcare delivery today, I think you're seeing two models, right? So you're seeing folks that are bringing kind of de novo supply into the market, and whether that's tech-enabled or with new processes or opportunities. And the second is models that are able to kind of harness the existing supply in the market. And that's really the approach we take at Tomorrow Health, right? There's over 32,000 home-based care providers across the country, whether that's medical equipment suppliers, home care agencies, home health agencies. But many of these businesses are largely subscale. 90+% of them do less than 5 million in revenue, and so don't often have the capability to invest in technology or better processes. And we see that certainly on the medical equipment side, as well as in other areas of home health. And so a huge part of our focus as a marketplace is really bringing the technology, the tools, the support, and the services to enable these existing businesses to operate more efficiently and to elevate their standard of patient care. So it's much more a model of partnership than it is acquisition, if that makes sense.
Thanks, Anne-Marie. Justin, Reggie, one of my former students. Do you want to ask your question?
Yeah, thanks so much, Nimi and Vijay,
Hi.
for coming in. Hey, team. So my question is around kind of where the majority of your focus is today, because you mentioned the more like acute setting where you want to avoid hospital readmissions. And I know that there's a lot of spending that's disproportionately focused, especially toward a patient's end of life. And you think about the spend that Medicare has, and curious if like what split you are seeing between that more acute setting versus maybe the more palliative hospice care and all of the DME that comes associated with that stage in life.
Yeah, it's a great question, and I'd even add a third, right, which is what we think about is not just post-acute care, but also pre-acute care, right? And I think that's an area where we really think about a re-architecture of the role that the home as a site of care can play on the care continuum, right? Too often we've thought about it as a post-acute site of care, right? And as programs have been driving patients towards the home, it's really about shaving off a day or 2 days of either inpatient visit or a post-acute visit at a SNF or an LTAC facility, and getting that patient to the home. We're really much more focused around how do you make the home that epicenter? How do you coordinate more effectively the equipment, the supplies, the services that patients need, such that it's not just about streamlining post-admission and preventing the readmission. It's about preventing the first admission in the first place, right? And so directly to your question, right now it's a split for us. I'd say there's certainly a huge amount of utilization and need that comes from post-acute. So I'd say that's about a third to a half of our business. And then the remainder of that is actually folks who are managing ongoing chronic conditions that need equipment or need supplies to coordinate and manage that. And we're really focused on, again, really preventing that need to go to a hospital in the first place. So really across the spectrum of care needs that you'd referenced.
I have a question. Do you partner with any other startups in the ecosystem? I mean, let's just talk about New York for now, because now you're talking about managing chronic conditions. We haven't even talked once about virtual, visits and all that. So how do you work with any local?
Yeah, I would say we are currently in talks with a wide range of them. And I think we see tremendous opportunity in early and growth stage companies coming together to really build different components of this ecosystem, right? To Nimi's point earlier, I think one of the most exciting things in healthcare tech right now is you're seeing dollars flow in, but also you're seeing dollars flow into areas that you haven't seen before, right? And I think one of those areas that's really interesting is the focus on platform infrastructure, right? And you look at some of what, for example, Ribbon is doing on provider data. Many other companies are doing to ultimately, build foundations to that stack that can unlock, a different level of engagement or capturing of what has otherwise been typically siloed or archaic patient data. I think each of these layers of the stack coming together will really unlock the foundation for new models, right? In the same way that Amazon Web Services made it so much easier for people to start a company. I think nowadays, a number of the companies that are built that are enabling, like Zeus or Commune, that are enabling folks to plug into otherwise archaic electronic health record systems to capture payer data, to streamline patient billing in the case of, Cedar or Uda or some businesses on that side. So I think it's really been exciting to see the ecosystem develop, and we certainly have a lot of interest in plugging in different components of these players into our stack to really enable us to deliver that outsized impact to patients who need home-based care.
Nimi, since we brought up the tech stack, some of the companies that you have funded, I don't know just how many names there are, like Alma, K-Health, Maven, OneDrop. But Ribbon is a really interesting one. And they just announced a Series B fund, I think earlier this week. I'm just curious if you would talk about that whole sector, which traditionally hasn't been that sexy, right? But is some innovation there is obviously very needed.
Yeah, no, I think echoing what Vijay just said, I think we firmly believe that as care delivery goes more virtual, or I think in general, as we think about a continuum of care, the lines will start to blur between in-person and virtual. And we really believe that a new set of tools and infrastructure will be available so that companies can build, I think it's very analogous even to fintech, where companies like Plaid and others really drove a lot of innovation. So Ribbon Health specifically, they're very focused on creating a more robust data set around provider data. What's interesting just in terms of their origin story is they started as a care navigation tool. And what they found in building the care navigation tool was that it was actually really hard to build because the underlying data was wrong oftentimes, where a doctor practiced, if they even were still in business. And so that actually had them reframe and instead focus on building the data layer through APIs, making that accessible, and then having companies build on top and plug into it and improving the data over time. And so I think they're a great example of one of those like infrastructure picks and shovels tools. Another one called Medallion is workflow software for licensing and credentialing of healthcare providers. So making it faster for providers to be licensed in any number of states. And so I think these are all examples of kind of that same trend of like, how can you build software tools so that the next healthcare company doesn't have to rebuild everything from scratch. And I think we're going to continue to see a lot of great adoption there, which is really exciting and definitely like a theme we're very focused on.
Are there any companies that we should keep our eye on that maybe haven't gotten a lot of publicity?
Yeah, I think those are two. I guess they've now, grown, but certainly some younger ones. There's one called Source Health now, which is trying to sort of build the virtual care EMR, if you will. So it's a former director of engineering at Roe, and
It's called
help
Source
yes,
Health?
Source
Okay.
Health. Yes. So they're for any number of digital healthcare startups that are created, like how do you build workflow software so that you can manage, communication, engaging with the patient, exchanging information, really building modules of what would be a virtual care EMR, which, we're really excited about. And they're probably a little bit more under the radar right now.
Okay. I'm going to go back to audience Q&A. Anthony, would you like to ask your question?
Hi, thanks for having attending my question. I'm interested in knowing if Tomorrow is actually actively innovating in the area of care delivery models to the level of hospital at home programs, and perhaps innovating to develop unique transition programs across the spectrum to hospital at home and back. So I guess my question is about clinical delivery model innovation.
Thanks for the question, Anthony. I think I'll start by saying I think the evolution to hospital at home is just such a powerful trend in the ecosystem. We talk about really what's that full breadth of care delivery that can happen in the home. Hospital home, certainly on the most acute end of that, right? And I think expansion of hospital home will help us to unlock that vision where the core hospital is really just for higher need tertiary care, right? Which is what it used to be, back in the day before you had so much vertical and horizontal integration of the care delivery ecosystem. Now we're starting to see that unbundle. And I think opportunities to really have that full ecosystem happening in the home is really powerful. For us specifically, we see ourselves as really enabling and accelerating that trend towards hospital at home, right? If you look at a lot of the hospital at home companies out there, they've been able to deliver really strong results as relates to patient care and also cost savings, certainly relative to treating those patients in an inpatient setting. The challenge is scale. They're very operationally intensive businesses. Most of the businesses really have a very small footprint today. And we see one of the opportunities to really unlock that by coordinating and managing the breadth of the equipment and supplies and support that often enables those more clinically intensive models in the home. And so we're engaged with a range of companies that are performing hospital at home around ways that we can partner together and accelerate that trajectory. Ultimately, it's very aligned with the direction of healthcare that we believe in. And ultimately, I think, as you see more of the pieces of the puzzle come together, that is going to be a lot more commonplace than it is in today's ecosystem.
So we are just about at 1:20. We're going to try this breakout thing if it works. But if you have a hard stop at 1:30, you can leave. But before that, I just kind of wanted to ask both of you, what are you most hopeful for in terms of healthcare going into 2022? It's been tough. There's been a lot of ups and downs. So what are you excited about? What are you looking forward to? Nimi, what? Go first.
Yeah. I think obviously these past couple of years have been, I think, tremendously hard on our healthcare system, but I'm also very hopeful that, a lot of the digital adoption that we've seen will actually be a net positive for our health system going forward. I think you look at how much telemedicine has spiked, the number of people who have engaged in telemedicine at least once over the past year or tried it for the first time. And I think all of that is just really, really encouraging for the future of digital care. And I think also for the future of moving towards preventative medicine, which is, I think, what, really is a holy grail. So I'm hopeful that a lot of, what we've experienced during the pandemic will just lead to more productive adoption of digital tools in hospital settings, amongst health systems, in individual practices. And I think that is a great thing for certainly, startups.
Cool. Vijay?
Yeah. I would echo that. I'd also say that I think the healthcare industry, both clinicians as well as innovators, have really just done an extraordinary job over these last 2 years in many ways to kind of rise into the occasion. And I think there are, I think there's no question from the folks on the front lines, and especially for all of us in New York, really seeing that come to life firsthand, and the resilience that the city and our care workers have demonstrated. But also, I think the tremendous amount of collaboration that has happened in the healthcare ecosystem. And I think there's something that I'm most optimistic for. It's that collaboration carrying through. And one of the examples that I would point to is really just the embrace of incumbents in the spectrum towards innovation, right? I think for most healthcare startups, the challenge is not building a better product. To be honest, most of the existing products in healthcare kind of suck, right? That's why the industry is so broken. The challenge is getting that innovation to distribution, right? And we have a value internally at Tomorrow Health. I'll change the system from within, recognizing that in order to serve the widest breadth of patients, it's critical for us, to align our focus and drive value to, many incumbent partners within the industry that have that vestiges over a wide breadth of patient care and that have that distribution. And I think we've seen from payers and providers, large health systems, a tremendous embrace of innovation over these last 2 years, right? Looking for solutions to enable virtual care, remote care, care in the home, re-architecting their care delivery networks towards a remote and home-based environment. And I think they've seen the results in a pretty dramatic and staggering way. So I think the acceleration of that level of adoption is something I'm optimistic for. And I think it's going to have tremendous impacts on the quality and the efficiency of care in America.
Well, fantastic. Well, thank you both. It's great to meet you finally.